So what are the roles of preoperative therapy, including shots or pills or physical therapy, before you end up having your joint replacement? I think it's very important to consider all of these before jumping into the hip or knee replacement. We always say surgery can't be undone, and while the risks of surgery are much lower than they used to be, we want to exhaust all non-operative therapies prior to jumping into the surgery itself. So many of these therapies are quite safe, but there are some considerations with each of these. Many of the pills that we use are anti-inflammatories or Tylenol, and those can be very safe in the right patient. We must consider your other comorbidities that play a role in the use of these pills, so you'll want to talk with your doctor about, is this pill safe for me or not? Certainly shots have come a long way, and there are numerous shots that people read about on the internet for arthritis. Some of these shots have excellent track records for long periods of time, and some of them just don't really work at all yet or aren't to the point where we feel comfortable using them. Steroid shots are tried and true. They've been around for a very long time, and there are some long-term implications of using a steroid shot. Steroid shots have been shown to wear out the joint a little faster. For many of my patients, they're already to the point where it's probably not going to matter, so I feel very comfortable using steroid shots in most of my patients. Gel shots, also called Viscosupplementation, have been around since about 1992 in the United States. They were originally thought to be a lubricant, but we've shown over the last 30 years that they're not really a lubricant at all. They decrease inflammation through a separate pathway, and they work really well until you get to bone-on-bone arthritis. At that point, their efficacy or their effectiveness is not so great. I tend to use those in my younger patients or in my patients who are really adverse to surgery. And then we have excellent results when used in the right patient. So the gel shots certainly are things we should consider prior to surgery. Stem cells and PRP are something you read about on the internet all of the time. While PRP is starting to gain some evidence, the reason that insurance may not cover this is that the evidence isn't strong enough to allow the government or the insurance to pay for it under your plan. Stem cells have not really been shown to grow cartilage, and I think that's something our patients really need to know. While they are promising and while the future is bright for stem cells, at present they are also, like PRP, not being covered by insurance because the evidence is just not quite there yet.